So, good morning, everyone. And sadly, I have to report 2 new deaths in Albany County since yesterday. A woman in her 70s and a man in his 60s. And my thoughts and prayers are with the family, with the 183 people that have lost people to this awful COVID-19 and these difficult times. And it's tough. And to lose someone, regardless if they're in their 50s, 60s, 70s, or any age, is tough. So again, my prayers and thoughts go out to the family. Unfortunately, this is the 7th day in a row that we had to report people passing away in Albany County. And Dr. Whalen and I keep hoping, we were thinking we're going to be over 200, then we're at 170, 180. Then you look at the hospitalizations, which the governor changed with the microcluster. And we hope we're almost there, and light's at the end of the tunnel. But we have to get through this together, and we have to do the right thing, because sadly, unfortunately, more people are going to pass away before it gets better. And more people are going to get infected as we go on, and we'll talk about that on the dashboard. But again, to the 183 families, please take the time. My condolences, prayers for everyone, just to think about them at this difficult time. As of today, there's 8,120 positive cases of COVID-19 in Albany County. So we have a new positive rate of 178 positives over last night. There are currently 3,317 people under mandatory quarantine. And this is actually the largest number of people we've ever had placed under quarantine. And we broke it in over 3,000 for the first time on Sunday. So over 3,000 people. And, look at, it's one of the things that Dr. Whalen's called on for our medical corps. We're putting more tracers and more people into play, assigning more people to the health department. It's overwhelming. So I know that we're trying to reach out to you. I know people have called, and bear with us, because it's a lot of people, and Dr. Whalen can talk about it more. It's a lot of people to deal with, and there's not just, as she has said most elegantly all the time, it's just not one little step, one little phone call. There's a lot behind that phone call that goes into place, and it takes time. And to deal with 3,000 people, or over 3,000 people on mandatory quarantine is a lot. So again, another record we weren't happy to hit. Of the new positive cases, 17 had close contact with positive cases or positive people, 5 healthcare workers, and thank goodness no one at Shaker Place. 156 people don't have a clear source of infection at this time. And over the last 5 days, our average has been 176 new cases each day. Yesterday was 182, so we're going down a little bit. So as of today, 28,541 people have completed quarantine. Of those, 6,429 tested positive for the virus, and we have a recovery of 117 people since yesterday, which is good. Unfortunately, we now have 94 people currently in the hospital from the virus. Yesterday we had 86. But we had 16 new hospitalizations over last night. So when you take people that, thank goodness, got out and people went in, but 16, but it brought us up to 94, so you can do the math from there. 15 patients are currently in the ICU. That's up 13 from yesterday, so 2 new people in the ICU, which is not the direction we want to be in. So again, I continue to ask everyone, avoid large gatherings, wear your mask, cough into your arm, clean your hands, stay 6 feet apart. Do the right thing and we'll get through this. I know we're almost there. I know the vaccine's coming out. It's rolling out. I believe on Monday we get our first vaccine for our nursing home. If I stand correct, I might be wrong, but I believe it's this Monday we get our first round of shots for our for our residents and for our workers at our nursing home. We're almost there, but it's going to take time, and Dr. Whalen can explain it a lot better than I can, how it's going to take time to get the vaccine out to people, and it's going to take confidence in people to want to take the vaccine. It's an issue that I brought up the other day with our Black Caucus and members of that in the community that are wary of it. And we have to win and educate and win people over to show the importance of getting this vaccine shot. So again, we also know the microcluster zones are well known now to have hospitalizations ICU beds, workers, and all that calculated into it, so which is good. We continue to monitor the data along with our hospital capacities. That's why we have the smart board here today to go over some of the things. But a couple things I want to point out. Back in October 28th, those in the 50 to 74-year-old range made up 24.3% of our deaths in Albany County, while those older than 75 accounted for 73.6%. So using the most recent data on our board, you can see that shifting. Now it's between 50 and 74-year-olds make up 28.4% of those, and 75 years of age count for 69.69%. I know it's a lot to throw out. You take the time, look at our dashboard, and I'll go through it. But I know there's a lot of numbers I throw at people every day. But we're just trying to give you the up-to-date information that we have at that point in time, that snapshot that we're dealing with. And I think it's also just important to point out that 28.4% is a significant portion of our total deaths, especially when people try to discredit the scenarios of this pandemic. Another trend I have pointed out the last time we using the COVID dashboard, 30 to 39-year-olds now suppress the 50 to 59-year-olds in total infections and continues to grow. And that's something we pointed out very early on. Those in their 50s were typically a distant second to those in their 20s. So I'm going to go to the smart board, show you a couple of things that we're looking at. So even if you see, even before May and April, we went really down. When the apex went up, we went down, and steadily have climbed up. And you can see the trend that we've been doing since the beginning in November, and it continues to go up. The same thing here with positive cases. You can see before May, we were going down. We spiked a little bit in May, but we went down through June, a little bit up in August, and then we just steadily have gone back up in the wrong direction. And but this is what I watch: the 20 to 29-year-olds that has the most amount of people. But if you see the 10 to 19-year-olds, they're steadily climbing up, and they're not far behind the 30 to 39, and they're almost neck and neck with the 40 to 49. So the reason why I keep pointing that out is because they're the ones that have no signs or symptoms. They're the groups out there still playing sports and basketball or baseball, wherever it may be, just being a kid or playing in the streets. And they're the ones that come home to mom and dad or grandpa or their grandparents or someone older, and they infect them. And unfortunately, we get the opposite results. And the male and female was getting closer, but the females, for some reason, are affected more at 53%. And the data Dr. Whelan will get into. But as you can see, total tested today was 8,000 for a positive result of 2.73. So, and tested positive today, and it just goes into the full data, and I'll bring it back up for Dr. Whelan so she doesn't have to go through that. But again, that's the one thing we continue to look at and will continue to look at. I'm not trying to scare parents. I'm not trying to say, hey, look I get it. Kids want to be kids. I know you want to have basketball tournaments. I know this is the last year for seniors. I get it. But we need you to continue to do the right thing, and this is why. It's going to get tough this next month before it gets better. And what we do today is going to help us get through it. So please, just take that step back and realize we can get through this together. But Dr. Whelan, while you're up.
Thank you. Good morning, everybody. So this is a graphic that I do like to go over several times because I know there still remains some confusion about when people are infected and when they can transmit to others. If you see on this, if you're exposed on day 0, it says May was exposed to COVID-19 on day 0. May got tested on day 5, and the results came back negative. And we know if you test too soon after exposure, even though the virus may be starting to replicate in your body, it's possible that you'll have a negative test. Day 8, thinking she didn't have COVID, she went to work in a family gathering. She was contagious day 8 and 9, and now exposed 22 people. Day 10, she became symptomatic and tested positive. So On this day, thinking she was negative, she was in a gathering and exposed other people. And because of that, she unwittingly spread COVID. And this is why COVID is tricky and why we continue to talk about the importance of avoiding large gatherings and social gatherings. On our website, it's important to point out for people that may be under quarantine or have just been diagnosed, we have posted our isolation and quarantine guides as well as orders, so people can get some information on that. And then looking back at the data that we see, I continue to think that this curve here is one of the most dramatic to look at. You know, it was about a month and a half ago that we stood here talking about, are we entering a second surge? I think if you look now at where we are compared to where we were with the first surge, we've seen that not only have we entered a second surge, but we are really experiencing growth beyond what we saw the first time around in terms of numbers of cases. So this is where the concern is locally. This is where the concern is from a state perspective and nationally, because as our cases continue to grow, we are concerned that hospitalizations will grow, and what we don't want to do is overwhelm the system. So looking again at the hospitalization data, we do continue to see disproportionate burden of hospitalizations in our Black and African American communities. If you look at our county demographics, Black and African American residents are 11.4% of the population. They are 22% of the hospitalized and 21% of the ICU patients. So we know going forward that it's going to be very important to engage our community partners on strategies to continue to control, on strategies to continue to test, and ultimately, which is the bright spark of this past weekend, in a campaign to be able to vaccinate. This weekend, we saw the beginning of the end. It is very heartening to know that we now have a vaccine available for members of the public as it rolls out. So the Pfizer vaccine was authorized for use, and as all of you know, the first doses of this were administered yesterday at Albany Medical Center. This is a very good thing. Over the weekend, the CDC hosted conference calls on the vaccine, which all local health departments in New York State participated in, to learn more about the vaccine, about the rollout, and about information that we will share with the public. It's very important that we continue, as we get information, to share that with the public. We know that the Pfizer vaccine, which is being deployed currently to our frontline workers and our nursing home residents and nursing home employees, is incredibly effective. We know that it is safe. We know that it is our most important tool so far to stop this pandemic. The vaccine is given in 2 doses, 21 days apart. After the second dose, there's usually a week to 2 weeks before full immunogenicity kicks in. And after that, we're seeing prevention rates for disease of around 95%. So this is incredibly important. We also know that there's a second vaccine from Moderna that is being contemplated, and that hopefully we will have information on within the week. So the coming days and weeks are going to be very important in planning for vaccine deployment. We have been involved in this planning as part of our pandemic planning for more than 10 or 15 years. But in particular, we have been reviewing our local county plan. We have been working with the state, and we stand ready to partner with the federal government in the deployment of this vaccine. However, it is important for the public to know that this is not an imminent option for members of the public. It will likely be months before this is rolled out to the general public. So that is why, as we continue to see the numbers increase, it is more important than ever that people continue the very important public health advice that we give around avoiding large gatherings, crowds, continuing to wear your mask. This is the best thing that's protecting you right now against COVID, is wearing this mask. And we know, too, that epidemiology has shown us that a lot of transmission has occurred in small group gatherings, and these are household gatherings. As we come into the holiday time, when people want to gather, when they want to get together, unfortunately this year we have to do it differently. It involves a little bit of sacrifice, but that sacrifice could help prevent a loved one from becoming ill, being hospitalized. It could save lives. So we continue to ask members of the public to think about the coming holiday season differently this year. The news is good, but it will take some more time for us to be able to enact the strategies to get this pandemic finished. And likely that will take, at least 6 months. So patience is still warranted, and behavior change is still essential so that we do not continue to see our numbers climb. Thanks.
Thank you, Liza. And I do want to remind everyone, the governor put out a bunch of EOs yesterday, which we're rolling through, that's going to give the authority for people to give the shots. So depending on how the vaccine comes in and how quick we're going to be able to roll it out massively in a couple of months, it's going to depend on the plan of action. So as Dr. Whalen has said time and time before, please, anyone who wants to join our medical corps, any doctors out there, any retired doctors, nurses, anyone that could help us give shots or get this vaccine out, we appreciate if you step up to the plate and want to give back to everyone here in the capital region, because we are in this together. And depending on how it's going to roll out, whether or not the role that we're going to play going forward, we have our plan in place. But the governor can change it, or the state DOH can change it at any time. But we're ready if we are called upon to put that out and get it massively out there, not just through pharmacists, probably through Walgreens, CVS, Rite Aid, places like that, any pharmacists in the county, and using a variety of other means. So again, if you want to volunteer, please step up and help out. Now's the time for you to do it, and we can do it safely by wearing your mask, coughing into your arm, cleaning your hands, and staying 6 feet apart. And we'll get through all this. But Dr. Whalen, thank you. And I just want to remind everyone about the testing again this Monday and Friday at the Times Union Center, Wednesday at the Watervliet Dome, and our partnership with Whitney Young. You can call Whitney Young. You don't need to have insurance. We pay for it, and the number is 518-465-4771. And also UAlbany, as always, 1-888-364-3065. And again, you have Price Chopper, CVS, Priority One, and the rest of them. And we're still trying to get the answers about Walgreens and a few others that aren't given the rapid test if there's a shortage or they're just so backed up. So I have not got that answer. So the person that keeps asking me that on Facebook, I apologize. I did not get the answer back. And to everyone that comments or emails us, yes, we look forward to your partnership, for your answers to help us get through this crisis. And again, we're not perfect. I don't pretend to be perfect, but we can get through this together and working together and being part of the solution, not part of the problem. So again, we'll get through it. It's Albany County. Go to albanycounty.com and see which testing sites are the closest and which ones provide testing for children and which ones have the rapid test. But I do want to share this with you from a 4-year-old Andrew, who sent this e-card message to our for people at Albany Shaker Place, our nursing home. Thank you, Andrew, for taking the time to do that. And again, you can go to Albany County Kids Care at albanycounty.gov. You can send these e-cards. It does make a difference for our residents and our workers, and we enjoy seeing that. So Andrew, thank you for taking the time to send that card. Also, our mental health support's available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. Our partnership with United Way, 211 in New York State hotline, as always. So again, thank you to everyone out there doing the right thing. I know there's a lot of people doing the right thing, and we're going to get through this. Please stay safe and healthy,